As in the case of all excess symptoms, this would be an acute state with recent onset. An acute illness is a mixture of pathogenic and the anti-pathogenic factors between action and reaction. For instance, if there was an injury or inflammation, the yang would increase. A healthy yin would increase to fight the yang and to protect the body. The pain that the patient experiences in this situation would be both during activity and in rest. This would be an excess situation for both yin and yang for a short period of time. And then one of these two energies would win the battle and one of them would decrease. This then becomes the subacute state where the pain would show dominance of either yin or yang. If the patient was exposed to cold, this would cause yin excess, especially in the kidney or urinary bladder related meridians. A healthy yang in the kidney or bladder would increase to oppose the yin dominance. This would cause a stiff and incapacitating backache with yin and yang simultaneously in excess. This both in excess situation could be treated either by sedating only the causative factor, which would in turn bring the other down, or when it is not clear which increased first, then both could be sedated. Example, a patient has acute backache after cold exposure. He's stiff, it hurts to move and to be still. He's cold in the back and heat is comfortable, but it does not lessen the pain. So sa treatment, local hot needles, many, sedate kidney 5's C-clef point used to sedate in acute states. You could add, when cause not clear, UB63 C-clef point sedation and UB40, the area distal point. Yin and Yang deficiency. The two main differences between the excess and deficient states of both yin and yang are excess state is recent, acute, and deficient state is chronic over 6 months. In the excess state, both are simultaneously in excess, so you would see symptoms of damp or cold and heat, shivering, and fever, and chilblain together. In deficiency, both are weak and cannot control the other, so one can rise at one time and the other can dominate one another time. So here, the tower diagram, both are deficient. Then this is followed by increase in yang or increase in yin. This would mean that if the patient stands for 10 minutes, the pain will worsen. If he sits for 15 minutes, it is painful too. So he has to stand lying down for more than 2 hours. It's very painful. So he has to get up in the middle of the night and walk around and take painkillers before going to bed. But walking for any length of time makes the pain very bad, so he does not go out of the house. The back feels weak and stiff, and the pain could be sometimes dull and sometimes sharp, radiating. This is how the patient would describe the pain. The pain seems to be sometimes yang and sometimes yin dominant in character, and it has a chronic history. Sa treatment, use more local needles with superficial insertion at the early treatments and gradually increasing the depth in consecutive sessions. Tonifying the yin and yang of meridian, first using mu and shu points only. In the third or fourth sessions, these could be substituted by tonification points of both yin and yang meridians. Use moxa with cigar, but only to mildly warm the area and not allowing skin color to change. Advise very moderate back and abdominal exercises while lying in bed. Clinical example, We have a male, 47 years old. This patient came to me, sabi ng author, with a constant low back of over 3 years duration. He always had a back problem, but in the last 3 years, it had worsened to the point that he had to stop working. He had been a plumber and was now a house husband. He has thin with a permanent look of agony on his face. He felt his back was very weak and vulnerable, and he had quite a few epidural injections in the pain clinic. With pain returning within days after some of this, he was afraid of surgery and was taking many pain medications and suffered abdominal pains due to this. Sabi ng author, I treated the patient with many local points, starting with shallow insertion and gradually increasing the depth of the needles. Ren 3, UB28, the Mu and Shu points of urinary bladder for 3 sessions, and later, kidney 7, UB67, tonification points, and UB40 as distal point. I also gave him point heart 9, small intestine 3, and PC6 as points against depression. The treatment was given twice weekly, and he came by taxi each time. Luxury he could ill afford, but he could not drive or use public transport because of the pain. There was no improvement at all in this time, and after 12 sessions, we decided to stop treatment. After 3 months, he phoned to tell me that the pain had started gradually diminishing and had completely gone. He was very pleased that we had continued the treatment sessions for the period he did. Even though there had been no improvement during the time, since then I have treated every one of my patients with chronic yin and yang deficiency backache for 12 sessions. Whether or not they improve during the treatment time, generally, the patient will not come for treatment if there is no improvement within 4 to 5 sessions. I tell them at the initial consultation that the pain relief could come after 12 sessions have been completed, so they may be willing to continue. It has been my experience that acute pains need frequent treatment sessions within a short span of time. 1 to 2 times daily at the start, then 3 sessions weekly until pain is 90% better, as excesses take a short time to be dispersed. Conversely, chronic cases require less frequent sessions and longer periods of treatment. Twice weekly at the beginning, after 50% improvement change to once weekly, stop gradually by increasing the intervals between the sessions. In every deficient states, maintain with once monthly session for a few months. Kidney opens to ear, sensitivity, hearing. Every element is associated with a sensory organ, and kidney opens to the ear. In the Western medicine context, this sounds quite illogical, but in TCM, kidney is related to physical activity, just as the heart is related to mental activity. And overtiring the body may result in tinnitus. Kidney relates to bones, and otosclerosis in the ear could cause conductive hearing loss, and cold exposure could cause middle ear infection. When children are born deaf, they are born with kidney yang and qi deficiency. Sensitivity to hearing is a yang activity and function, and problems with hearing would be symptoms of kidney deficiency. If all sounds heard are low in volume, this would be nerve deafness. If qi deficiency, a qi deficiency symptom. This is either congenital or occurs in children with frequent ear infection causing glue ears, fluid in the middle ear, or in the elderly with weakening of the nervous system. But if there is a partial hearing loss, missing out certain frequencies of sound altogether, bone deafness, this is more likely to be a Yang deficiency symptom. This occurs in adult life after chronic exposure to noise or in osteosclerosis.